They are crying crocodile tears for the 1.5% of people who are losing their health insurance, the people who don't have Medicare, the people who don't have it from the employer. What about the 5 million people who have lost Medicaid because Republican governors won't give it to people, even though the federal government is picking up 100% of the tab? It seems like 5 million people are being denied health care just so they can make a political point.
Medicaid deductible, they're paying more money. That's not pro-middle class.
But let's talk about the Medicaid that's being denied, like in my state of Louisiana, where Bobby Jindal was saying, I'm not going to accept this money. One of the poorest states in the nation, where he's not doing anything.
How much money is Medicaid being spent in Louisiana today? How much money? It's driving state budget deficits everywhere.
Well, yeah, it's driving state budgets everywhere, but he's not doing anything about it.
But
he's not doing anything about it.
But it's the federal government that's paying for this, so it's not going to increase that.
For 3 years.
And then 90% after that. So it's not really going to... Well, okay.
It's not. This is not a fiscal call. This is a political call. People like Governor Jindal in Louisiana, Governor Perry in my beloved state of Texas. In Texas, 1 out of 4 Texans have no health insurance, and he's turning away money that, by the way, not only are poor people going to suffer, but hospitals who treat them are suffering. With the uncompensated care at any hospital, particularly in a state that isn't taking this new Medicaid funding, people walk in, they're terribly ill, we treat them, thank God, but then the hospital gets stuck with the bill and they pass it on to everybody else. Everybody who pays health insurance already pays $1,200 for the uncompensated.
We'll finish this up on overtime, but Obamacare here, let's do it. Will the failed Obamacare rollout make America less or more likely to adopt a single-payer system? Well, we don't know whether it's failed yet. I mean, you know, the website obviously was a big mess, but things look a lot better than they did a month ago, don't they?
Yes. California's signing up 10,000 people a day. States that aren't going through the federal website, where the governors actually believe in this, are doing really well. And here's the deal. The people who don't have to go to the website already win. So I don't have to go on the website. I've already gotten a rebate because Obamacare requires insurance companies to actually spend money on medical care or rebate it to their customers.
Right.
My mother gets mammograms on Medicare. My dad gets a donut hole prescription drug. No lifetime limits, no pre-existing conditions. My 21-year-old son is he's a junior in college. He stays on my policy until he's 26 and a senior.
But there certainly is plenty of socialism in our government, as there should be.
And you have
socialism isn't a dirty word.
No.
It just means government does some things that you wouldn't want to trust to the private sector, like life and death of people's health.
It's invoked, though, by politicians as the spectre of all evil. I mean, we all know that the bits of the American healthcare system that people like are the ones that the government...
Why do you think it is that every other advanced democracy has come to one conclusion, which is that you cover everybody, and they all do it. And only America has come to this other conclusion. What do we know that every other country that we would emulate doesn't know?
I'm not sure we want to emulate a lot of those countries. First,
well, in
this quality of care. We all agree. We all agree. It's just we disagree.
40,000 Americans die every year for lack of access to health care.
But there is no plan on the Republican side to get there.
When the tens of millions hit in January, you're going to be, in your monologue, next year you're going to be talking about, geez, peace. And we trusted him on that, too.
When the tens of millions...
When the employer market hits, when employers drop, which is going to happen, already begun, and you throw your employees into the exchanges, and the networks
at this point, I have to say that this whole Rube Goldberg contraption that is Obamacare was a Heritage Foundation plan crafted by a right-wing Republican think tank, adopted first by Mitt Romney.
That is true.
So don't you sit there and you throw your bullshit, jerry-rigged, market forces solution for health care.
No, because it wasn't a law. Because the Heritage... Governor, that's because the Heritage Foundation is not Congress. It was not crafting a law. What he is saying, come on.
Some of the ideas, sure. Not 2,300 pages of this stuff.
But
you know, why did you have to do it?
It was midwifed by Newt Gingrich, and then it was raised
by Tom Daschle.
Mitt Romney.
And you know it.
But so Obama's a socialist because he wants to pass Mitt Romney's health care bill,
just a bad bill,
John McCain's cap and trade bill, and George Bush's immigration bill. And he's a Marxist? That's his agenda, Bob.
I'm not saying he's a Marxist or a socialist.
No,
this is bad for the American middle class. And everybody...
I completely agree with you.
We'll see
the
if it
right-wing
is.
plan for health care is bad for everybody in this country, and we should adopt the socialist single-payer model and not this crap cooked up by the Heritage Foundation and adopted by a Democratic president.
But it does work in other countries.
It doesn't work so well.
It doesn't. There are lots of other countries where, I mean, America does, as Bill was saying, you spend 18% of your GDP on healthcare. You rank 37th in terms of world quality of care? Is that where you want to be? Is that the ideal scenario? It just doesn't. You have plenty of other countries around the world that have a mixture of public and private, Germany, Switzerland, Japan, not socialist countries as far as I understand, that have very good healthcare systems and where everybody is covered and they spend less.
Israel has single payer and so does Vatican City. Are those socialist countries?
All I can say is
material.
People get prostate exams at Walmart. I think there's a little room for improvement in our system.